Hello, I'm Dr. Vitaly Kushnir from Eden Fertility Centers in Newport Beach, California, and I'm here today on this special broadcast with my own sister, Sandra Kushnir from Meridian Counseling. I'm a fertility specialist, and Sandra, can you introduce yourself to everybody?
Hi, everyone. My name is Sandra Kushnir, and I'm Vitaly's little sister. I'm a psychotherapist, and I own a group practice in Los Angeles called Meridian Counseling, where we specialize in working with individuals, couples, and families.
Thank you so much for joining me. It's really a pleasure to have two members of the Kushnir clan on this. So the purpose of this meeting today is to kind of go through some of the emotional and stress type of issues that our fertility patients are facing, especially in this unprecedented time of the coronavirus going around. Many of our patients, to begin with, feel isolated because infertility is such an isolating diagnosis. They feel misunderstood. They don't have the support that they need from their friends, their family, often even their spouse. The situation now is that they're even more isolated. Many fertility clinics, including ours, have had to pause fertility treatments because of the non-urgent matter for most of these patients. And of course, it's not very fair because people out there in the world are getting pregnant on their own and nobody's telling them to not try to get pregnant. So I think this further compounds the isolation that many of our patients feel. And I'm hoping to get your sort of reaction to that and maybe talk a little bit about the different strategies that people can use to cope with the emotional stress and so on.
Yeah, for sure. First of all, yes, going through fertility treatment is a very isolating and unique experience. There's a lot of different feelings that get triggered. And one of the main ones that we see a lot with clients that come in that are going through fertility process is a feeling of chronic grief, because maybe they've tried to get pregnant on their own and they haven't been able to, or they've had a lot of miscarriages, or their treatment has been, unsuccessful and they've had to do a few rounds. And so you have this chronic feeling of grief and loss while you're still trying to also hold on to a sense of hope. And something that we're seeing a lot with this coronavirus outbreak is that we're all going through this even kind of like deeper level of grief where we're grieving our old normal and we're kind of unsure of where our world is moving to after this coronavirus outbreak is over. And so what we're seeing a lot of is people both going through fertility treatment and not, is people are cycling in and out of emotions that mirror the grief process. So there's a lot of denial, there's a lot of anger, there's a lot of bargaining, depression, and maybe moments of acceptance. But when you compound going through this with going through something like losing a pregnancy or not being able to get pregnant at the timeline that maybe you created for yourself, it can really be really traumatic and isolating. And so, yes, I think there's a lot that's going to be triggered for many people during this process, and learning to cope with it is extremely important. For me, I always say suppression leads to depression. So when you don't give space to your feelings and you're not able to process through what's coming up for you, you're actually setting yourself up for long-term effects that might manifest in, a major depressive episode or a trauma reaction or generalized anxiety disorder. And so I think it's really important that people, especially during this time, carve out space in their everyday lives to process and connect to their bodies, to their feelings, and maybe meditate or journal and give space to themselves to have a human reaction to this process. Something that I like to tell people who are going through grief in general that I find really helpful is to have a Word document that they keep open on their laptop. And every time they maybe feel flooded or overwhelmed with feelings, to just open up that Word document and give voice to those feelings and try to use Kubler-Ross's stages of grief to label what's coming up for them, and just leave that Word document open-ended, kind of like a letter, where you're able to kind of go back and reflect of like how your emotions are cycling on a day-to-day or maybe hourly basis, just to keep track of it. Because sometimes when we hold these things in and they're just inside of us, they can become very overwhelming, and being able to see them outside of ourselves and on a piece of paper or on a screen allows us to kind of get more to a logical place where we can regulate our emotions a little bit better.
That's a wonderful suggestion, and I think that does help to put your thoughts into writing, and it actually helps me in other ways in my life. So often, oftentimes we have ideas, but until you write them down, it's difficult to fully articulate them and fully tease apart those ideas. So I, of course, write a lot of articles and research papers and so on, and I do find that it helps me get at complex issues and separate them into their components, and really helps me get at the truth. But I think you're right that it can help also with the emotional aspects of a difficult time like this too. You mentioned the different stages of grief. Can you go a little bit more into that?
Mm-hmm. Yeah, so every person grieves differently. We all have different responses to grief and loss, but usually there's a 5-stage cycle that people will go through, and you can go through the cycle in a different order. The 5 stages are denial. So at first being like, this doesn't apply to me, this isn't something like that's real, and convincing yourself that maybe it's not happening or that it doesn't directly affect or impact your life. And most people are hit with the denial part like pretty early on when they hear like, oh, you lost this pregnancy, or you had a family member that maybe passed away from coronavirus, and it's kind of this like numb, shocked feeling where you're struggling with accepting what's actually happening. That is usually followed by a period of either bargaining or depression. So you're either going to be telling yourself, well, maybe this isn't real. Can I do something different? Like maybe I can have more control over it if I call all these people, or if I like go back and do something different, maybe it would have been different. So you're kind of going through this process where you're wondering, can I change something that it happened, and is it in my control maybe more than it is? And then the next stage you move towards is depression. So really feeling sad and like kind of starting to absorb and process what's happening, and feeling hopeless, maybe sleeping more, maybe crying a lot or not eating. And then, that's usually where people start kind of reaching out for help and like realizing like, okay, like I'm not sure if I actually have that much control over changing my circumstances. Usually the depression phase is the longest phase, but the next stage is anger. So feeling like you were robbed of something or you lost something. And the anger is an interesting one, and especially I think with fertility treatment, because there's so many aspects of anger that happen that maybe aren't fully processed for a lot of patients, regarding anger at like their bodies and themselves, maybe for failing them, anger at their partner, anger at the medical system, anger at people who are able to have children in an easier way. It's very complicated, and it often creates a lot of feelings of confusion and cognitive dissonance. Cognitive dissonance means that you don't understand why you're acting the way that you're acting, right? So maybe you're being a little bit more aggressive or irritable towards your partner, or maybe you're like avoiding and talking negatively about a friend who just recently had a baby, and you're not understanding like why all of a sudden you have all these like weird emotions and anger towards these people. But that's a normal process of grief. And then after you go through the anger and depression, you kind of cycle into a stage of acceptance where you're able to kind of like integrate the loss and make meaning of it, and use the loss as something that you can move forward from as a different person, not necessarily always, in some cases, if it's not fully processed in the proper way, a positive way, but most people, when they get to acceptance, are able to integrate the loss into their lives and make meaning of it and move forward, if it's dealt with in the proper way. And each person can cycle through those different stages in different ways. So some people might stay, between anger and depression and might never go through bargaining and denial. Other people might go through all of the stages like every day. So it's a very individual process in that way. But what we see with most people that are going through some sort of grief and loss, that they tend to go through all of those stages at some point.
I think you're absolutely right. And I see it all the time with my fertility patients. And now that this coronavirus is upon us as a country, and we're seeing it on a national level, many of those things playing out. If you just turn on the news, I think you hear a lot of those things that you just outlined on different channels, maybe in different stages. I'm wondering for my fertility patients, is there a way to speed up the process? So let's say that someone is at the depression stage of this. How can someone like you, a therapist, help them overcome that stage and move on to acceptance and gain some control over their situation? Because again, infertility is so isolating and people feel powerless over their own bodies and over their circumstance. So how can working with a therapist help them overcome these issues?
Yeah. So first I want to say, I don't think there's a way to speed it up because it's very unique to each individual. And a lot of that is based on your resiliency and your personality and your own kind of like genetic makeup of how sensitive of a person you are, how logical you are, intelligence. There's a lot of things that play a factor on how quickly you go through the grief process. So I don't want to say that there's a way to necessarily speed it up, but I think what's really important for people to understand is if you don't process through it, it will continue to be there. So even if it feels, years later, like you've moved on from it, it's still going to show up in different ways in your life. And it can come up, in jealousy towards other people or avoidance of certain situations, or maybe low self-esteem or chronic anxiety or trauma or depression, as I mentioned. So I think it's really important for people to understand that if you don't deal with something, it's not like that thing has magically gone away. It's just been put in a little box that's deeply buried underneath, being busy or like other aspects of life. And at some point that box is going to get open and these feelings are going to come up. And when they do, it leads to a lot of things like self-sabotage wise. You might blow up your relationship, or you might, be really aggressive towards your child and not realize why you're being so aggressive to them. So it's really important that people seek help and do the process of therapy, because it's able to give more insight and meaning and help them work through those emotions so that they're not controlling them at an unconscious or conscious level at some point in their life.
Absolutely. I think those are wonderful suggestions. And in your experience working with a therapist, how can that help individuals or couples get through these grieving processes?
Yeah. So what I hear a lot with people coming in is, I've talked to my family about this. I have support with my friends. I have a great community. But what we need to remember is that our family and our friends are not trained professionals, and they can only offer us, their opinion and their support. Therapists are trained. They have master's degrees. They go through hours of clinical experience and supervision, and they are able to really conceptualize things in a different way than a family member or a friend can. And I think it's really important to have a non-biased opinion or perspective that helps you work through your own process. Because sometimes, families and friends can have the best intentions and be like, oh, everything's going to be fine. You're going to have a baby one day, or you should get over this. Like, life goes on. And like, they're coming from a good place. Their intention isn't bad. But a lot of times comments like that or these types of conversations can be perpetuating the trauma, because they're making you suppress and push those feelings down. And in my opinion, I think it's very important, to understand what's going on with you and how this integrates into a bigger picture, right? If you have a lot of trauma and unprocessed grief, right, from going through multiple fertility rounds, and then let's say you end up finally getting pregnant, but at that point you're exhausted and worn out and angry at your body, and it's taken a strain on your relationship, it might impact the way that you parent your child when you do have a child, because some of those feelings of anger and resentment might unconsciously be trickling over into how you show up as a parent with your kid. And then you might be more irritable with your kid, or you might be less patient, or you might project and hover over them too much and be a helicopter parent and not allow them to properly separate from you. So it's really important that these things get resolved and processed, and that you have professional guidance on how to do that because our family and friends just aren't equipped into helping us do that deeper level work.
So those are a lot of excellent points, and I fully agree that during the fertility journey or the infertility journey, it's very helpful to work with a therapist to help overcome some of these issues. But perhaps I've underestimated or didn't realize how important it is, even for people who've been already successful in their treatment, that they may develop some of these bonding issues with their children, and even after they've been successful in infertility treatment and have had a child, that perhaps it's not a bad idea to continue seeing a therapist into early motherhood because of some of the issues that you outlined, with helicopter parenting and overbearing parenting or resentment issues. I've definitely seen that in my practice, but perhaps have never, focused on it as much as you just illuminated this issue.
Well, I just want to say, like, the first 5 years of a child's life are incredibly important for the child's entire lifespan development. And so the attachment is formed in those first 5 years. That's when a child learns language. It's when a child learns to walk and talk. And they're basically a sponge where they're absorbing everything around them, right? And the main kind of like mirror for them is their mother or their parent. Usually in therapy, we focus more on the mother because that's usually the primary caregiver. So if the mother has, symptoms of PTSD or postpartum depression or unresolved grief and loss issues from multiple miscarriages, or there's tension in the relationship because the intimacy has died, it's going to be really difficult for that mom to properly mirror to the child. And that is where that early kind of deep emotional world starts being formed. So if there's some sort of disconnect there, right, if the mom is feeling really depressed and unable to play with her child in the proper way, or if the mom is unable to separate from her child and let her 3-year-old kind of explore and have control of their world around them, then that child's going to either learn like, oh, my experience doesn't matter and have like very low emotional intelligence, or they're going to be afraid of like taking risks because every time that they go somewhere, their mom's like, what are you doing? And like overprotective of them. And that ends up transcending into adulthood, right? The types of relationships we choose or the type of partner we attract, the type of job that we do, our ability to take risks appropriately. So it's really, really important that people understand the impact of this like long term, not only on their own lives, but on the lives of their potential future children.
Absolutely. I wanted to talk to you a little bit about marital conflict and relationship conflict in patients that are going through fertility treatments. There have been a lot of studies done that actually try to measure stress levels in infertility patients. And it turns out that someone who's newly diagnosed with infertility will have similar stress levels as a newly diagnosed cancer patient. Mm-hmm. So this takes an extreme toll on not just on their body, but their relationships with others, especially their spouse. And so I wanted to get your perspective on that and maybe some insights into ways to cope with those relationship issues.
Yeah, so obviously going through fertility treatment isn't the most romantic thing. Doing injections, doctor's visits, it kind of takes the intimacy aspect out of the relationship a lot of times. And so it's really important that couples are intentional about putting their relationship first and continuing to do nice things for each other, like designating one day a week for date night where they are able to spend time with each other and like have conversations that aren't focused just around work or getting pregnant or things going on in the world, but when they're checking in with each other and saying, how are you doing? How are you feeling? Like, what can I do for you this week to help support you? And like really showing up for each other in that way. I think that you also mentioned about how stress hormones impact women. I think when a woman is pregnant and she is experiencing a lot of stress and is in this situation right now with coronavirus, I have a few patients who are pregnant currently. And the biggest advice I have to them is to really up-level their self-care routine. Because what happens is if the mom is experiencing high levels of stress, her body is producing adrenaline and cortisone and all the hormones that go into our fight and flight response. which is our response that is wired in our limbic system to keep us alive and protect us from danger, right? So you can imagine right now, everyone's fight and flight response is pretty triggered because we're in this very unknown situation where we don't know what's going to happen. And there's a lot of like people dying and a lot of stress and jobs being lost. So our brains are sending our bodies messages that we're in a life-threatening situation, like a tiger is attacking us. So our levels of those hormones are going out of balance very easily. And especially when you're pregnant, what's happening to you is happening to your baby, right? There's a mother-child exchange happening. So research has shown that children who were born to mothers that have gone through a lot of trauma during pregnancy, or women who are more wired towards being anxious or stressed, those children actually end up kind of absorbing those higher level of chemicals, and they end up being more sensitive children. So they're more likely to have anxiety, they're more likely to be colicky, they're more likely to be fussy, which then makes it difficult on the mom, who's already dysregulated emotionally, to be able to appropriately take care of and attach to the child. So what ends up happening in that dynamic, right, is the child doesn't get its needs met appropriately because it's been kind of set up not to be successful because the mom didn't implement proper self-care techniques while pregnant to help manage her own emotional reactions. So I've told all my pregnant clients, like, right now is the time. Like, you can't control the situation, focus on what you can control in your environment. Like, if that means, setting up the nursery and like maybe like taking a bath every night and like reading a nice book, meditating, just to check in with your body and like learn to calm yourself down, drinking chamomile tea, doing things that really like relax and calm you down so that your hormones aren't like creating all these disbalances and it's not impacting the fetus.
I think what you're saying is very much in line with what's called the Barker hypothesis in our field, and that looks at women who are under extreme levels of stress during their pregnancy and their children that are born from those circumstances. And of course, there are much more extreme situations than the one that we're in today. For example, women who are pregnant during times of war or during times of famine. And it turns out that their children are actually smaller for gestational age than their older and younger siblings who are not being carried during that stressful episode. And those children actually have a predisposition to survive in that increased stress environment. That's sort of how they're in utero programmed by the woman's body. But if they're born in a world where that stressor has gone away, let's say the war, the famine, or the coronavirus is no longer upon us and things are sort of back to normal, then they're maladapted to their new environment. And it turns out that those children will actually have higher risks of long-term health issues like diabetes and heart disease and things of this nature. So I do think that there's a lot of validity to focusing on people who are currently pregnant to mitigate their stress levels as much as possible, not just for their own benefit, but also for that of their newborn children that are yet to come. I wanted to get your take on patients who have miscarriages specifically, and maybe a little bit more in depth on what men who are partners of women who are having fertility issues can do to support their spouse.
Mm-hmm. So with miscarriages, I think that is a huge kind of niche that isn't talked about that much because it's something that's uncomfortable and we don't really know how to help somebody who's gone through that really process through those emotions, right? Depending on what stage of the pregnancy they were in when they miscarried, it's kind of a taboo subject. And we are, as humans, wired to avoid uncomfortable situations. So a lot of times we won't bring up or ask somebody like how they're feeling after a miscarriage in order to keep ourselves comfortable because we don't want to make that person sad, or we don't know what to say, or we don't know how to relate to someone that's gone through that. But I think the most important thing is to not shy away from it and lean into those conversations. Like, it is a loss, just like going through a loss of a family member who's an adult or a child. And it's important to check in with that person, ask questions, show up and support them as much as you can, and to know that like maybe it's important to be sensitive. Like if you have children and your friend went through a miscarriage, like maybe not to bring up things about your own experience and make it about you. A lot of times I think people jump in to comfort people and are like, well, you have a kid one day, like it's okay. You can always have another baby. And they're very dismissive of what that actually feels like. So I think it's very important to kind of take a step back in a lot of ways and check yourself and treat it just like somebody who lost a child, basically, because that's what it is to a lot of people. And not to lean away from the conversation, because it's an important conversation to have. And I know a few people who have gone through miscarriages, and for them, you know, it's completely changed them as people. Who they were prior to the miscarriage and who they are after the miscarriage is two different people, and it's changed their perspective on what's important in life, and it's something that can be a huge trauma. So that's kind of my take on that. Yeah. In regards to men, I think that that's a huge, that can be like a whole episode in itself, honestly. But I think men in our culture are not taught to understand or verbalize or share their feelings with others. So, you know, women struggle being vulnerable, but men are like on a whole nother level with vulnerability. And I like to say, like, it's very hard, because how can you expect a man to appropriately respond to his partner when from the day that he was born, he was told to man up or to stop crying or to be logical, or that he's a pussy if he shows emotions or whatever. So I think it's something that we need to create more conversations and space around, and to recognize like the male partner is going through this process with the woman. And a lot of times the men are overlooked. He's also lost a child. He's also lost intimacy in his relationship. Sometimes men feel guilty having their own feelings of grief and loss around it, because they see that their wife is going through all this physical trauma and emotions, and they feel like it's not appropriate for them to have their own response. And so they end up suppressing those feelings, sometimes even more than women do. And then that comes out a lot in substance abuse or working too much to avoid, you know, sitting with the partner, being home as a distraction. Like, it shows up in a lot of different ways. So I think with men, the first thing that I would say is like, they need to first take care of themselves and give themselves space to have their own grief and loss process, and to give their emotions a voice as well. And I like to tell partners, whether you're going through IVF or you're just in a marriage in general, you should designate 1 hour a week, like on a Sunday or a Saturday, where you guys just check in with each other about the problems in your relationship. So if something that week bothered you, if something that week was triggering that the partner did, instead of like fighting about it in the moment when you're hijacked and you're feeling frustrated, you can save that for that hour time and be like, hey, on Monday when I was talking and you just started talking over me about your own problems, I felt really disrespected and I felt like you weren't listening to me. Because that way you've had a few days to step away from the emotional reaction and to process what you want to say, and you're able to communicate that in a more effective way. But I think especially couples that are going through fertility treatment, I would say that that's like an integral part of keeping their relationship in a good place, is to once a week have a venting space where they're able to check in and see, how are you feeling? Like, what feelings are coming up for you this week? Like, is there anything I can do to support you? Is there anything that you think I could do differently that maybe didn't work the way that I handled it last week or whatever? And make it okay to have more radically honest conversations that are sometimes avoided because they're difficult or they're uncomfortable with couples. And I think for women, it's really important to step back and realize like there's another person in the relationship too. And it's important for you to check in with them and see how they're feeling about everything that's happening, instead of just like making it about yourself. I see that a lot of times where pregnant women get like really tunnel vision and they're just thinking about like nesting and themselves and the birth and like all of that they kind of leave their husbands behind a little bit and leave them out. So it's important to notice if you're doing that and kind of like bring yourself back and be like, okay, I have to check in with him. How's he feeling? And notice when you're doing that, which for me, I think starts with being more mindful and being more aware of yourself and having more insight into your emotions, which happens through journaling, therapy, and meditation.
Thank you. That's very helpful. I see now so many patients with male factor infertility where the primary reason for the fertility issues is the men, and I think those men have a very hard time coping with this because it goes against everything that they've been sort of taught about manliness and what their expectations are in life, and suddenly they find themselves in this situation. So, and that's a whole nother level on top of the men who are just there to support their female, but it's partner, but it's mostly the infertility issue is mostly her rather than him. So they're two very different dynamics, and I agree with you that we should probably have a follow-up session to focus more on men and the relationship issues and in those various different scenarios. Mm-hmm. So far, this has by far exceeded my expectations. I've learned a lot, and you've reinforced many of the things that I have observed in my own practice. When we were talking about miscarriage, for example, what came to mind is that when patients come to me for fertility evaluation or for evaluation of prior miscarriages, they will often try to give me very little information and try to sort of speed over that part of their medical history. And oftentimes I have to sort of slow them down and ask them in a lot of detail to tell me about each pregnancy and how far along you were when you lost pregnancy, what were the circumstances, what were the medical issues involved. And that allows me, of course, to take care of her next pregnancy in a more cohesive and integrative way. But you're absolutely right that I think a lot of this, a lot of the reasons for why women sort of overlook this is because it is so stressful, and they want to just forget about it and just kind of put it in their past. But you can never get past it because it does affect your future, both medically and from the mind-body perspective.
For sure. And that's a normal trauma reaction. I just want to point out, so people are aware of how we respond differently to trauma. A lot of times when we think about trauma, we think about a soldier coming back from war that experienced a death or saw people getting blown up in front of him, or a car accident or something like that. But trauma is unexpected losses. Trauma is conflict in relationships and divorces, and trauma is a lot of different things. We react to trauma in two ways. We either react to it in a hypervigilant way, where whenever, maybe every time a woman sees a baby, she starts crying and has a really strong grief reaction and, has an intense feeling of loss and gets flooded with that. Or there's the avoidance reaction where we don't want to talk about something, or we kind of shut it out and pretend like it didn't happen. And what I'm sure you've seen with a lot of those patients is they kind of have compartmentalized that part of themselves and talk about it as though it's a story that happened to somebody else. And there's this kind of disconnect with it, or there's an avoidance about talking about it in general. So that's a normal reaction to trauma, and something that I think a lot of people need to be educated on is if you're doing either one of those things, it clearly shows that there's some unprocessed feelings there that need to be properly addressed and dealt with.
Thank you. I think this has been very enlightening. I think the whole mind-body concept is the future of fertility medicine, and that's why I enjoy speaking to you about these issues, and I learn every time we do this. I want to end on a positive note, and maybe you can give us a message of hope, and I will give one as well in these difficult times.
Yeah. So for me, I think that the world is going through a shift right now energetically, where we're all, as traumatic as all this is and as unknown as it is, it's also an opportunity for us to really dive deep and sit with ourselves and understand what parts of our lives maybe aren't in alignment and what parts of how we're showing up isn't in alignment. And right now is the time to really go inward and be radically honest with yourself. You know, if there is some grief that you haven't dealt with, if there's some things in your life that are no longer serving you, that are holding you back from being the best and highest version of yourself, this is the time to really like be honest with yourself about that and make the difficult choices to change those things in your life. I think all of this has really brought to light how short life actually is for a lot of people, and that we really need to take responsibility and ownership to change things that no longer work for us. So I'm viewing this as an opportunity for myself. You know, I've been doing a lot of meditating and journaling and self-reflecting and all of this. And I know that there's some things that I need to work on that I conveniently was avoiding with the busyness of starting a business and work. And I really think people need to use this as an opportunity to redirect their lives in the direction that they want it to go, and to really express gratitude and be self-compassionate towards yourself during this time. And for me, I think the world will be different after this experience. I think we're going through a collective trauma that is changing the fiber of how we relate to each other. And I'm a firm believer that through darkness always comes light. So for me, I think we're going to live in a better world after this. I think people will be more grateful for their cup of coffee in the morning, and for the teller at the grocery store, and for being able to hug their parents and loved ones. And this is just a reminder for us to kind of refocus on what truly matters and to become the best version of ourselves.
I couldn't agree more. And the example that keeps coming to my mind is where we're starting the Passover holiday this coming week, and where we truly celebrate the plagues that passed over the Jewish people, but humanity in general. And this plague will pass, and at the end of it, of course, is freedom. So we hopefully will emerge from this stronger and freer and as our better selves after this dark moment in our individual and our collective history, is hopefully ends very soon. So thank you so much for joining me. Again, I'm Dr. Vitaly Kushnir from Eden Fertility Centers in Newport Beach, California, and I'm a fertility specialist, and it was lovely to have my sister, Sandra Kushnir, who's a therapist at Meridian Counseling in Los Angeles, join me today.
Yeah, thank you for having me.
Thanks, Sandra.